So my name is Susan Plunkett and I'm a cardiologist. A heart murmur essentially is an abnormal sound that you hear when you listen to somebody's heart, and generally it indicates turbulent blood flow. So the simplest way is by somebody listening to your heart with their stethoscope. So when you go for your routine checkup with your GP and they check your blood pressure, it's always worth them having a listen to your heart as well. And then there are some other physical findings that sometimes will help tell us if it seems like a serious problem. And then if that's the case, then looking at your heart directly with an echo scan, an echocardiogram, is really useful to find out what's causing the murmur and if there's something needs to be done about it. Well, it depends a little bit on what causes the murmur. So some murmurs are benign and you can have some turbulent flow just because your heart is healthy and pumping fast and the blood is rushing through. But sometimes it can be caused by an abnormal heart valve, either a valve that's too narrowed or is leaky, and that can definitely cause murmurs. Depends what's causing the murmur, but certainly if a heart valve is severely narrowed or severely leaky, that can lead to symptoms of chest pain, fainting, and even heart failure. Heart failure when your heart just isn't able to pump effectively, and that can lead to things like swollen legs and breathlessness. Murmurs essentially come about naturally, and there's not really anything that we do as patients that can make a murmur happen. Some conditions are associated with progression of valve problems, so perhaps people with very bad kidney function, they can be more likely to have valve problems, and sometimes people are born with abnormal valves that can become narrowed or leaky over their lifetime and need to have something done about them. But generally they just happen and we just have to look for them and manage them as and when they come about. Like I said, your doctor can usually have some idea about how serious it is by examining you. But if there is concern that it might be a serious problem, then a heart scan, an echocardiogram, is the best way. So that uses sound waves to have a look at your heart and work out if there's a problem with any of the valves.